We've explored the regulations, the risks, and the potential fallout. Now, let's shift our focus to solutions. What can Canadians do if they disagree with these changes? How will these regulations officially become law? What is the process?
Well, there's several parts to harmonizing the regulations, and one part's already come into force. So, in our 2023 budget bill, they basically moved us into the pharmaceutical drug category where we've got these $5 million a day fines. Now, the NHPPA, so Natural Health Product Protection Association, has sponsored a private members bill that had gotten into committee to undo this, but an election's been called, so we're kind of
Right.
back at square one. But as far as the cost recovery that I'd spoken about, which literally will, you know, likely take away all traditional Chinese practitioners and homeopathic doctors, and when we're fully enforced, the naturopathic doctors too. This this licensing scheme is not going to allow licensing for conditions that these practitioners use. Those haven't been gazetted yet, but the cost recovery. So the way regulations become laws is you publish them in the Gazette, which is the government newspaper,
Okay.
and people comment on them. And then you can accept the comments or not, you can change them or not, and then you just republish them in the Gazette too, and they become law. We're expecting that to happen sometime this year, and we
Okay.
had gotten some indication it could have been happen. It could happen like immediately. Likely, the election will put that on hold for 5 weeks, but we could find ourselves in the situation. At Health Canada's published timeline is this year. So this year, we should find ourselves in the situation where manufacturers are facing these new costs, and most of them are saying we're going to drop most of our products or stop business in Canada altogether.
So, are there specific advocacy efforts currently underway to challenge these regulations? Is that where your organization comes in?
Yeah, and so I mean, we've got the full title of my organization, but our website's www.nhppa.org. And so we educate you about what's happening, and we ask you to subscribe to our email and follow us on social media, because we've got consistent campaigns going to try and stop this cost recovery, stop the self-care framework. And we've been really successful over the years. We're a federal nonprofit. We've been doing this since 2008. And
So,
yeah,
on your
and
website, what can they do? Can they contact their MP through your website? Can they sign a petition? Or can they read up on more information about the bill or the law?
all of the above. So we actually, have a campaign right now where basically you can send an email letter to some Health Canada bureaucrats, because we're trying to put direct pressure on Health Canada right now. We have a campaign to put pressure on some MPs. We've got the Charter of Health Freedom petition, which we want you to sign. And then, right now, I mean, I've got a call this week where we're organizing people to make this an election issue. So
Okay.
we're hoping in every riding we'll have people creating an election issue so that the new parliament is aware that they need to be responsive to the citizen on this.
So, if Health Canada is set on implementing these changes with the election coming and everything, do we have any chance of stopping or modifying them?
I'm always hopeful. I don't want to believe that I live in a country where, fundamental freedoms like how we're going to choose to treat ourselves when we're
Yeah.
sick or how we're going to prevent ourselves from getting sick, that we don't have those rights. Now, Health Canada is acting as if we don't have that right, that they should be the sole ones to choose. But even if it gets worse before it gets better, I believe that, Canadians will stand up and will insist that they have the right to choose how to prevent illness and to treat illness when it occurs. So I'm optimistic, but I think we have a bumpy road.
So, what if we don't do anything? What are the risks?
Well, if we don't do anything, then full stop, we're going to be in this chemical drug model, and we're going to lose most of our healthcare practitioners. There'll still be, vitamin C, vitamin D in that, but it will be more expensive, and it'll just be provided by, a handful of small companies. The economists call it rent seeking. And we'll no longer have innovation, and most of the innovative products that literally are saving lives or managing chronic illness will disappear.
Shawn, thank you so much for your time.
Thanks for having me, Julie.
At the heart of this issue is a question of choice. Should the government have the power to restrict access to the products that Canadians already rely on? Are we safeguarding public health or surrendering the freedom of choice? Whether or not you believe the answer is simple, the conversation is urgent. If you care about your right to choose, now is the time to speak up. Visit nhppa.org to learn more, stay informed, stay engaged, and advocate for yourself.